am shocked by how often even doctors mistake osteoarthritis for rheumatoid arthritis in the hands and vice versa. Rheumatologists are specialists at discerning between the two, but I don't want you to have to wait to get in with one before having some idea of whether you're dealing with osteoarthritis or rheumatoid arthritis. So we're going to go through the 5 signs your hand pain could be from RA and you need to see a rheumatologist. At the end of this video, you'll be an expert in your own hands and you will know what next steps you need to take to get relief. I'm Dr. Elizabeth Ortiz and this is Connected Rheumatology. Let's get started. Arthritis in our hands is very common, and it is absolutely a legitimate concern to wonder if your hand pain could be rheumatoid arthritis. But before we get into the 5 signs to look out for, I want to make sure we're all speaking the same language. So what is osteoarthritis, or OA, and what is rheumatoid arthritis, or RA? So osteoarthritis is a degenerative type of arthritis. It's the wear and tear arthritis we all think about when we say the word arthritis. It's what we think of when we think about the arthritis of our knees, hips, or backs, but it can happen in any joint, including the joints of our hand. Rheumatoid arthritis is a systemic autoimmune condition. This is a problem with our immune systems that just happens to mainly affect our joints, but it can really affect any part of our body. Although some of the symptoms are similar, the two conditions couldn't be more different, and the way we approach treatment is also very different. Osteoarthritis of the hands requires strengthening exercises, hand therapy, possibly injections or other procedures, and care is best managed by a combination of an orthopedic surgeon and an occupational therapist. RA, on the other hand, requires a systemic approach with medications and anti-inflammatory lifestyle changes, and is best taken care of by a rheumatologist. These differences are why it's so important to know which one you're dealing with if you have hand pain. One of the biggest ways to differentiate between OA and RA is the presence of joint swelling. True joint swelling happens in rheumatoid, not osteoarthritis. But how can you tell if your joint has true swelling, as the joint changes that happen in osteoarthritis can also cause our bones to change, become bigger, and then look swollen? Well, the joint swelling of RA is a result of inflammation within the joint that leads to fluid buildup and soft tissue swelling. So the swelling will feel soft, squishy, and even hot to touch. The knuckle changes of OA don't feel this way. They feel more hard, knobby, and cold. The swollen knuckles of rheumatoid arthritis tend to be very tender to touch, but OA knuckles can also be tender, so this isn't always a great differentiator. If someone has a lot of swelling, it can be reasonably easy to feel this, but to be fair to my fellow docs, it's not always that easy, and it can take a lot of practice to get good at detecting true joint swelling. Which is why we look for other clues, like in the wrist. The wrist is a collection of joints that can have either rheumatoid or osteoarthritis, but it is much more common to have wrist pain, swelling, and even limited range of motion from rheumatoid rather than osteoarthritis. In fact, it's rare to have rheumatoid arthritis and not have wrist pain. When our hands start to bother us and we notice we are having difficulty gripping things or we are getting more achy, we tend to only focus on the fingers, but really take some time to think about your wrist. Check out how easy it is to move it and if moving it causes any pain. Similar to our knuckles, the wrist in rheumatoid arthritis can get swollen, soft to touch, and warm. And FYI, the base of the thumb is not the same thing as the wrist. This is an important distinction because the base of the thumb is a super common area in osteoarthritis. Many people think they're having wrist pain when actually it's pain at the base of their thumb. Another clue we look for is which knuckles are problematic. To get to the point, if your pain is really just in these last knuckles of the fingers, what we call the distal interphalangeal joints, or DIPs, then that's OA. RA does not affect these joints. Having changes in our DIPs from OA, like getting knobby knuckles or even deformities in these joints, is always a big reason for concern, but let me say it again, This is from OA, not rheumatoid arthritis. RA will affect the two other rows of knuckles, the proximal interphalangeal joint, or PIPs, and the metacarpal phalangeal joints, or MCPs. Now, these joints can also have osteoarthritis, so if you have a mix of joint involvement, paying attention to swelling, your wrists, and the rest of this list are going to be super important. But if you are only having involvement of the DIPs, then I'm less concerned that it's rheumatoid. Now, I would be remiss not to mention that psoriatic arthritis, a type of autoimmune inflammatory arthritis that is closer to RA than OA and is associated with psoriasis, can affect the DIPs, these things. And yes, this fact really trips everyone up. So like with everything else in rheumatology, we can't just take one clue. We have to take all the clues to draw a conclusion. Mornings with arthritis can be rough, but are usually much rougher when you have rheumatoid arthritis. Getting stiffer as we get older tends to happen, so we often just assume, I guess I'm just at that age now. But when we have inflammation in our joints from rheumatoid arthritis, the stiffness can last up to an hour. This means we aren't really moving comfortably in our hands for the first hour that we're awake. A lot of people will compensate for this by taking an ibuprofen in the morning or the night before. Or they will wake up earlier and stay in bed reading or stretching to warm up the body. Or others will find that putting their hands in warm water first thing in the morning will kind of speed up the process. Those with OA will also find that they get stiff in the mornings and they can be quite scared because of this. But when pressed, we'll note that really it only lasts a few minutes, half an hour at most, and they're quickly able to shake it off. So start paying attention to your mornings, the routines you may have started that you didn't realize you were doing, and take note how long it takes you to get comfortable in your hands. And then finally, there's everything else you feel aside from your hands. Remember, osteoarthritis is a degenerative wear and tear joint issue, meaning it only affects the joints, whereas rheumatoid arthritis is an autoimmune condition. RA's root problem isn't actually in the joints, it's in the immune system, which means people will tend to have issues outside of their hand joints. So take stock of any other joints that are causing problems, like your feet, your ankles, or your knees, and pay attention to your energy levels. The inflammation from rheumatoid arthritis is just like inflammation from a cold or the flu, which means it's not uncommon to feel run down when you have a lot of it. Someone with hand OA will often describe to me feeling frustrated as they feel good but are limited by their hand pain or weakness, whereas someone with RA will have hand pain but won't really describe frustration in the same way, as they don't really feel great in general, and aside from the hand pain will feel sluggish, brain foggy, and feel not quite like themselves. So I recommend taking note of which knuckles are problematic, how your wrist feels, and if you have joint swelling, how your mornings go, and if you have any other symptoms aside from your hand pain. Take this to your primary care doctor, and if it looks like you're dealing with osteoarthritis, you can find an occupational therapist to start hand therapy, as maintaining your strength and function is going to be key in getting you relief. If there are enough signs that point towards rheumatoid arthritis, your doctor can order some blood tests like the rheumatoid factor and the anti-CCP antibody. And if you want to learn more about those tests, you can check out these videos next and put in a referral for a rheumatology evaluation. I hope this has been helpful and provides you with a framework to think about your hand pain. As always, share this with anyone you think could benefit from the information, and I'll see you next time.